Welcome to Akhand Vidyashram, the first institute of medical wisdom. We are going to talk about heart and vascular system or cardiovascular system with the perfection keeping Divyank in mind. Let's start straightway structure of heart itself. You can see heart in the middle. Now, there are two things to be kept in mind. Let's start from venous return to the heart. That means superior and inferior vena cava bring blood from the entire body. You can see blue right on top into the right atrium through the hole in the right atrium close to which SA node is present. From there the blood flows to tricuspid valve to the right ventricle, and from right ventricle goes to pulmonary semilunar valve to the pulmonary trunk to the lungs, and in lungs hemoglobin throws the carbon dioxide out and takes the oxygen in, and oxygenated blood is carried by pulmonary arteries from the lungs to the lung tissue where pulmonary circulation is. Then pulmonary veins do bring blood to the left atrium, and left atrium it goes to the bicuspid valve or mitral valve to the left ventricles. From left ventricle to the aortic semilunar valve goes to aorta, and through general circulation of arteries, arterioles and through capillaries, blood is distributed to 100 trillion cells of the body for perfect homeostasis. This is a perfect design of cardiovascular system which I want every child to know from very beginning till end. It is not the prime function of the artery is not oxygenated blood. It is more to carry blood from heart to the periphery and veins from periphery to the heart. Definitions I want perfect, impeccable wisdom, the day one. And cardiovascular system is very important, efficient cardiac system along with the blood, with all the nutrients from digestive system for all the functions of the human body. Once we have a package of human body with the 10 organ systems playing independent role to make us perfect in tune with universal consciousness. Pindandam Tantra is as perfect as Brahmand and Mahabrahmand, and that is with Divyank and nothing other than that. In that light, let's move on to the next stage to understand how beautiful is our system. Now, my mission is the impeccable wisdom as I know, knowing which everything is fully known, and that discovery of 70 years of my life plus has given me the greatest discovery of the humankind called Divyank, the divine design of nature, with which the perfect object of the entire universe, starting from Mahabrahmand to Brahmand to the solar system to the human body, right up to DNA structure, right up to sodium and chloride structure, is designed with only Divyank. And in that light, we are going to look at cardiovascular system perfectly so that we have a knowledge, uniform knowledge throughout the world for every student, every research scholar, every teacher, every documented books and otherwise. That uniformity is being brought by Akhand Vidyashram, Shiv Bhushan Sharma, by and large, and let's leave it at that. Now, as I've been saying, I being a medical doctor, my first objective is that we human beings are designed in the cosmic design of the universe to be the Lokpalan or guardians or custodians of the world. If we are going to be physically perfectly healthy, free from all the diseases, emotionally perfect, stable, mentally very alert, attentive, intellectual, buddhi, intuitively in tune with universal consciousness, and also having a social responsibility, religious tolerance and love for the entire humanity. Our objective should be, we should be healthy, wealthy, wise and happy for perfection of the entire universe under the guidance of human beings who have the uniform knowledge to only make things perfect and perfect for the world peace. We should not have the division, terrorism or otherwise spoil. We are made a custodian. Let's think of a custodian, become a custodian. That's it. Now, the reason why we fail even to achieve disease-free life is our ignorance. We haven't been given the kind of data, information, knowledge and wisdom which can make us give an impeccable wisdom of perfection. At the same time, unfortunately, when I see the entire world, we are not as dynamic, as intellectual, as perfect as I want. Almost everyone I meet invariably say we are imperfect, we should continue to be imperfect, keep fighting, and that is love. That is not what point is. I am just like one, but I do believe I am perfect and I want perfection, and that sight for perfection has given me Divyank. Now, we have the definition knowledge of all the 64 arts. We do not know the perfect anatomy, we do not know perfect physiology, we do not know perfect biochemistry, we do not know perfect psychology. As a result, confusion is made. We do not know the divine mathematics. We have man-made mathematics, and which is confusing. Even researchers are doing research on thing which was done 600 years ago, trying to find fault with it and add new confusion. That is with respect to everything around the world, including Nobel laureates. Father gets a Nobel Prize, son says it's defective, and son also gets a Nobel Prize. Einstein gets a Nobel Prize, 100 years later 3 people come and say he was wrong, and they also get Nobel Prize. Where is the value? Where are we evaluating? Do we have perfection? And that is not there, and that perfection is brought for the first time in the history of mankind in the form of Divyank from 2015. And in the respect of Divyank, we want the research to be done once again. With Divyank, I can tell you, you'll have a uniform syllabus for every student, perfection. But I do know I'm a single person. I don't have the influence, nor do I want the influence. I would like to leave behind the legacy of my work in my way for the benefit of humanity, for the benefit of everyone. I have everyone's benefit in mind. Let's move on to the next stage. Now, cardiac muscles are the unique muscles. There are 3 kinds of muscles: skeletal muscles, smooth muscles, and cardiac muscles. The skeletal muscles are made for bringing things from the external world. They are responsible for mobility and locomotion. And smooth muscles are designed for digestive system as well as perfusion. But when it comes to the question of cardiac muscles, they are the fantastic muscles. They start functioning from 2nd month of gestation till we die without stopping even for a moment. And that's it. And it is structured, you can see all the 3 on top. But vital part of cardiac muscle, there is a nucleus, there is red artery, there is a blue vein, interlocular disc, soft tissue, hard lines, and cardiac cells. That's one part. Now, in this particular thing, unlike skeletal muscles and smooth muscles, we use glucose for energy, but here fatty acid is used so that you can 2.25 times more energy, and we do not produce lactic acid and pyruvic acid in the process, so muscles do not get tired, they are excitable, they remain contract, and they maintain beautiful thing because nature had designed to make structure in such a way as a one united form and then give the world continuous thing without any problem whatsoever. Now you have the cardiac muscles, right atrium, left atrium, and ventricle muscles. You can see it very clearly in this form how they function, and that function is very specific for the world to understand how heart works very ordinarily. Now comes this particular picture I have explained many times. There are 10 stages of beta oxidation. Right side you can see fatty acid formulas. Carbohydrate C6H12O6 is the formula of glucose, fructose, etc. But from here, same formula, but oxygen has been taken out. You can see the oxygen is less. Then you have C1 and H2 the same throughout except the last 2 parts. But O2 remains same. The idea is remove oxygen, then bring oxygen for beta oxidation to produce more ATP. That's it. That's a beautiful part of this particular system which I want people to realize, that without perfect anatomy, physiology, biochemistry and psychology, you cannot understand the beauty of heart, cardiac muscles, cardiovascular system otherwise. Now come to the next stage. We have a perfect cardiac cycle, which make the heart function beautifully. Let's explain. Cycle events of heart per minute is heart rate of 72 or 75. The duration could be 0.8 seconds. Let's say cardiac cycle duration is 0.8 seconds. There are two phases: systolic contraction, diastolic relaxation. Then atrium as well as ventricles have two different rays altogether. Atrium, I would say, is like a storage part. It's like a bhumi made of 1 into 7. The ventricle is more dynamic, like the dynamic of Divyank answer. Let's say atrial systole. Contraction of atria, duration is 0.1 second only. Anterior diastole is 0.7. The ratio of 1:7 is like what I talk about. Earth has 7 parts. Antariksh is made of 7 parts. Heavens are 7 days and other thing. That secret of power of 7 is seen here too in atrial, systole and diastole phase itself. When come to the ventricle systole, it has also contraction of ventricle. Duration is 0.3 seconds. And ventricle diastole is 0.5. But I would go to the extent that systole is 38.1966% and diastole is 61.8034%. That is Divyank, more precise to the point that we cannot make the mistake at all. Now, Divyank, the divine design of ventricle of human heart, I have told you it is in the same ratio as that. You can see the picture very clearly. So here itself we can see the beauty of Divyank in the structure, Divyank in atrial part, Divyank also in ventricle part. So look at the beauty of the heart. Now comes to the question of pacemakers. As I've been saying from the day one, there are 3 organs have 7th level of nervous system. Digestive system has a pacemaker because absorption of glucose, nutrients and other things should be there even if you are unconscious. So you have been given local government of pacemakers is required. Similarly, heart is very vital to keep us alive. It has also been given 7th level of pacemakers. And I would say there are 4 pacemakers: atrium, ventricle, SA node and AV node. 4 things let's skip. Now let's understand the pacemakers of the heart step by step. Now as you see, there is SA node in the left atrium. You can see the green part, which is very close to where superior vena cava and inferior vena cava are entering into right atrium. So very clear, SA node is placed close to the place where venous blood returns to the heart. I have been saying again and again, stimulus for SA node is a venous return pressure, not anything else. And the signal starts with the pressure itself. And that is also the research which has been done but not carried forward. Dr. Victor Solomon did that almost maybe 45 years back, published. But the world is not even aware of it. But anyway, I am bringing it together, that's SA node. Then they will have 3 atrial nodes. And you also actually go into the left atrium. You can see the picture very clearly. Then the 3 put together come to AV node, atrioventricular node. You can see at the green part, the second part. And then you have bundle of his. Then you have the left branch, you have the right branch, and Purkinje's forward to this. Again, conducting system of heart is made of 10 parts again. This is again amazing, which I say, everything so beautifully designed, so meticulously designed. So I can really say, Divyank, the first stage, all the cells are made of 21 parts, 1 becomes 22, and then they go to 10 stages, and the maturation is a divine design for perfection everywhere. I want people to forget about what has been done for generations and centuries. We need to restart with Divyank once again and do research. We'll have positive results without any confusion for anybody and everybody. There will not be any problem, provided we have a perfect knowledge. We have a problem with science because it's a man-made designs, not perfect. Divyank is perfect, we can do wonders. Now, as far as heart is concerned, I have been making it very clear. Sympathetic system will increase the heart rate, whereas parasympathetic vagus nerve will reduce it. And now this picture I have already given this. And similarly, if we create a block to supply to the conducting system can independently work. In that case, the normal heart rate, which is 72, would become 100 to start with if the stimulus is with SA node only. But provided venous return is clear. Second thing, AV node, it will be 61.8% with the heart rate. Bundle of his will be 38.2, and further down, go down, then you will have a ventricular escape, a low temp heart rate, maybe 25, 35, but we can still circulate because it has the capacity to regenerate. And this is also something we got to know about cardiac beauty. Come what may, we should survive. But sympathetic is to make it excitatory in case of emergency. Parasympathetic is rest, digest, conserve energy for future use. The balance of sympathetic and parasympathetic as an autonomic nervous system is absolutely essential for a perfectly healthy, wealthy heart, strong for life, once together. Now to come to the question, action potential SA node and atrial ventricle, you can see the situation is like this. It goes up, comes down, goes up, comes down. But I will not go into this particular stage because resting could be 70, 55 could be threshold. But this is very simple, but it's only for SA node and AV node. This is nodal action potential only. This is not necessary for general public by and large. Leave it at that. Now I am trying to bring a concept of Divyank with respect to skeletal muscle thing. Its RMP is minus 70. When stimulus is strong, it goes to minus 55, then depolarization to 35, then repolarization, hyperpolarization back. This I have already explained, and I have shown this particular picture is 1,000 times better than the picture which we teach to the students, which has confusion. I brought that all together for people to understand we need this kind of science, not a half-baked other idea. We should be precise, points to everything mathematically designed, not a philosophical otherwise. Science has to, I think the scientists have to realize we cannot be finding fault with the old science. We have to start once again, fresh, which I have done in my life. I am able to produce 8 Hz frequency throughout my brain with eyes open anywhere and everywhere, which is not done by anybody. But it's a phenomenal work. It opposes all what neuroscientists say. So similarly, at every stage, what is done is a copycat. I want it to be done once again with Divyank. I can tell you, you'll have phenomenal uniformity in theory and practice, and you'll have a uniform knowledge throughout the world. The confusion which we go through, many a research thing, in the light of the older knowledge is defective. We need to think. But I know I have not been able to publish basically because people don't have the mind to think rationally separately. So I have taken the right of doing one thing, getting it published in my books, Quora and these answers, and leave behind for the world to take it. Because it's not going to be accepted for journalists and other things because they have a different way of it. I'm not finding fault. They're used to that. That is their system. Whereas we have to find something unique so that we can stand out perfectly. From that angle, as I told you, raising of both the legs, if you lift it high, it becomes a pressure for SA node, and SA node will start functioning very well, is one particular thing which I've said. Anyway, we're going to talk about it. Now comes to question, action potential of the cardiac muscles is very different from skeletal muscle, which I showed you. It is also different from atrial potential also. Those are shown, and now I'm going to show you something which is very unique with the heart ventricles itself. This is more dynamic than skeletal muscles, than atrial muscles. Now you can see that atrial muscle I have already shown you earlier, showing once again. And here you find the potential comes to the left action potential. Energy comes, it goes as a whole thing. Systole, depolarization takes place straight away. Then you have a repolarization of sodium coming out. Then you have a plateau, which is because of calcium. Then repolarization is because of potassium. First sodium goes in, then sodium comes down, then calcium is able to sustain it for 0.3 seconds, more or less. Then potassium keeps coming, and then sodium potassium pump to come to the stage, and this is what ECG is, this is what is potential. And this is where in heart, sodium, calcium and potassium, all the three play a very important role. As you can see in this particular, right at the bottom, the green is sodium going inside, and then potassium is coming out. Then calcium is going in, then potassium is coming out. Then potassium is coming out again to equalize. If this is what it is, I think is very clear how out of 0.8 seconds, 0.3 seconds or 38.1966% will be ventricular systole only. And it's beautifully sustained because it has to maintain for 0.3 seconds. It is not a quick of skeletal muscles. This is not quick of the IC node or AV node. This is heart which has to maintain contraction for 0.3 seconds or 38.1966. That's the reason calcium has been brought in along with sodium and potassium. Once this is understood, I think we are very clear that we understand ventricular action potential very clearly. Now they come to the question of integrated action potential. Threshold discharge is there, then production goes on. But this is only to show with the sinus and this. But at this particular juncture, I want to bring one more factor into the play. When heart rate is 72 or 75, you will have no problem at all. But when heart rate goes more than 100, it is the diastolic phase which is maintained, and relaxation phase, diastolic phase comes down. But left ventricle, let's say muscles of left ventricle, receive blood during diastolic phase only, relaxation phase, not during contraction, because the whole thing gets contracted and arteries are blocked. But they open only when heart blood pressure comes down, then only they get supply. So my advice to everyone is, in case of heart attack, keep your heart rate as low as possible. Bringing it down to 60 will be better because you will still get blood supply to the heart. But if it's going to increase tachycardia, you are in for a big problem. That's the reason I'm talking about that in excitations, things would go faster. Whereas in relaxation, things are very good for heart. Maybe that's why in Akhand Yoga I talk about it. Bring the mind to very calm and quiet state. It's good for your heart, good for your body, good for blood pressure, good for everything. That's why Akhand Yoga plays very important role in my life. That's the reason I've been able to get 8 Hz alpha frequency through the brain with eyes open, because I'm calm and quiet and everything is working as systematically as should be with the autonomic nervous system integration. And of course, endocrine gland, other thing. That is what it is all. Now come to the question of radial pulse is a very important part as far as I am concerned. Because one of the easiest way as a medical doctor I felt I should see the pulse of every patient, and according to Ayurveda, from the pulse itself you can easily make out what kind of problem the person is having. Ayurveda centers only on radial pulse. But unfortunately, it has not been given that kind of importance in allopathic system. But I, being an allopathic doctor and also being knowledgeable about Ayurvedic system, I would bring something which is required for everyone on their own itself to find everything with the radial pulse itself. Number 1, the 3 fingers you put it on that, proximal, middle and distal. One is towards the heart, one is away from the heart, and this will give you the different things one together. Number 1, things which are very important. Pulse pressure can be made out, blood pressure can be made out by doing this itself. If the blood volume is complete, your pulse will be full, big, bounding. Heart rate will give you percentage 72. Also at the same time, the condition of the arteries would also be known by rotating it around. If you can rotate it without hardness and its full volume, tension is good and rate is normal, I can tell you, you are perfectly healthy. But as you are weak, pulse will become weak. There will not be enough water. Respiration defective, so is heart rate defective. This can be controlled with the mind control itself. So from that angle, I would go for Ayurvedic system using the radial pulse to find the volume, tension, anxiety, conditions, almost all the factors through pulse itself. 1 minute you should do, not less than 1 minute. And condition also you can figure it out. And once that is done, I think you are on a very high plane to understand this concept very, very clearly. Now the question, now in the radial pulse again you can find there are 3 phases. The main phase you can see is full, then you have a tidal wave, and then you have a dicrotic wave, third one. Now you must be trying to understand what are the 3 waves due to. First wave is when left ventricle pumps the heart and blood is pushed into aorta. That first pulse is because of blood being pushed by the left ventricle into the aorta. Second thing, when systolic blood pressure comes to a diastolic blood pressure, the arterial system, say 120 to 74, when it goes less than 74, then things come down. Then after that, atrium muscles, which are cardiac muscles, which is the aorta in the beginning part. I'm not talking atrium of the heart, which is the right ventricle or right heart or the left heart on that. I'm talking about muscles of the aorta. When they pump, you can see the third phase. That's it. Because they also have a cardiac muscles only. And once we have understand this, you can easily find. The first part of 2 is like a systolic phase of 0.3. The last 5 would be diastolic phase of 0.5. Once this is understood, I can tell you, you understand from pulse itself how beautifully the heart can function. And people, Ayurvedic people were masters in doing that. And I'm also trying to do that ever since my college days. And as a result, seeing 100 patients a day for 30 years, hardly 1 or 2 people needed to be sent to hospital for admission. Otherwise, I could prevent all the problems in my hospital itself. Now come to the cardiac output, which is very essential for any heart to understand. What is cardiac output? Cardiac output is the amount of blood pushed out by each ventricle of the heart every 1 minute. And it is calculated by the heart rate into stroke volume. It could be around 5 liters per. But there are other things which I want you to understand now, the vital definition with respect to cardiac output. And diastolic volume is very important, and it should be 120 ml. That means the amount of blood in the heart ventricle after full relaxation. Please remember, after full relaxation in heart should be 120 ml. Stroke volume is the amount of blood pumped by each ventricle during ventricle contraction, systole, and it should be 74 ml. Out of 5 liters, this is the value. And stroke volume is the amount of blood left in the ventricle after contractions of this should be around 46. 120 minus 74 is 46. These 3 are vital things. Then you have ejection fraction is the stroke volume of 70 feet divided by end diastolic 120 would be 61.8034. I would say the perfect ejection fraction is 61.8034, and it's because of water concentration, and I leave it at that. Whole design is designed with only Divyank in mind. And once we have these values, we will not be able to confuse, and that is uniform, give it to all the students to understand. Remaining disease model, leave it to the medical profession to take care of it. Let us not confuse students with disease models. Let's give perfect model to every student from school, college to the university. Research on medicine, leave it to those people who are working on that. That has a different thing. Now, cardiac index is a 5 liters divided by 1 second. The height would be equivalent to 3 liters. That's also something which is important. Now come to the blood circulation, which is absolutely essential for you to understand whether circulation is also designed with Divyank or not designed with Divyank. And I can tell you, everything which is perfect has to be with Divyank, Divyank and Divyank only. Now they come to the question of pulmonary systemic circulation as such. You can see heart, blood has come to the heart. From heart is going to the lungs right on top, same amount. And the percentage you can see is 9%. Then I will not confuse you too much. You have arteries, you have arterioles, you have capillaries. The structure will design later in detail. But one thing which I want you to remember is amount of blood in arterial system is 38.1966 and in venous return is 61.8034. The blood in legs, spleen is much more in venous form, and that is as a reservoir, at the same time to be used as an emergency in case there is a bleeding at all. That's the reason I keep saying lift the legs, bring the blood to the heart, circulate, and can save us from many of the problems thereafter. Sirsasana is also designed to reverse that, and the reverse can easily remove all the blocks of the heart. And that's it. Now, as I told you, the perfect systemic circulation, I think in the very picture itself, I showed you left ventricle to go to aorta to elastic arterioles and the capillaries, we are proficient in, then venules and venous to the right atrium, to the lungs, to the right atrium. This is structure which I have already seen the same thing here. But here one thing is, arteries are elastic arteries. They can expand and come down. That's why they have a tremendous amount of venous systolic sympathetic system to the blood. They play a very important role in increasing and reducing blood pressure and other things like that. When sympathetic is more, blood systolic will go up, diastolic could come down. So this is something which I want you to remember. At the same time, capillaries, it is only 4 micron size. As a result, perfusion can go out, but red blood cells and large cells of proteins cannot move out. That is also something which I have spoken about. You can hear very clearly because the structure is such that you hold a 4 micron size only. So only liquid things or solutions of smaller size can pass through, larger size cannot pass through. And there are controls before capillaries also, you can see it very clearly. But venous return, you have valves to check the return as such. As a result, your legs may not have a problem of varicose veins provided they are normal. I think that is important from this point of view. Now the percentage of different organs is also very, very important. Ideal systemic circulation is, let's say, brain. 55 ml for 100 grams of size, that means 0.700 ml per minute is pumped into the head itself. Is a phenomenal size. Then as to the heart is concerned, 200 ml per minute is shipped, which is equal to 4%. Brain is 14%. Then comes the question of liver, is almost like 1.35 liters which is almost 27%, goes to liver because it's essential for assimilation. And all the detoxification and other things are important. So liver plays very important role. It's a one big organ and gets 27%, 1.3 liters. Then next comes the kidneys, which are like a Divyank ratio, 1 liter every minute, which is 20%, because it has to eliminate. But when come to the percentage of ml per 100 ml of kidney, it is the highest in concentration, 400 ml per 100 grams, whereas brain is 55 ml, heart is 70 ml, liver is 100 ml, but here it is 400 ml. These are the four very vital organs to be understood. Then comes the skeletal muscles, is 1 liter, it's only 5 ml 100 ml, although the percentage is 21%. Then you have skin, is only 5%, 10 ml for 100 gram. Then other structure I have given clearly, the bones and other things good. If this particular picture is maintained, I can tell you, you are perfectly healthy, wise and happy. That's one. Now, as I told you, blood pressure has got a systolic blood pressure, a diastolic blood pressure. The mean diastolic blood pressure is very important. If you take the systolic blood pressure, it is 120 millimeter of mercury, and diastolic 74. Mean arterial blood pressure will be 93. As you can see, the left side upper portion is with the arteries. It is ratio of 120 by 74 with a mean arterial blood pressure of 93 is maintained. But then as you go to the capillaries to the venous return, it comes down. Then in venous return, in pulmonary side, it goes up and then it comes down again. Once you understand this particular picture, I can tell you, you have a better knowledge of cardiovascular system. If you can maintain blood pressure of 120 by 74, you are perfectly normal. Heart rate of 72, perfectly normal. And pulse is according to that, you are perfectly normal. And that is what you should try to achieve. But one thing which I have seen, I like to share here, if you are dehydrated, your systolic might come down, but your diastolic would go up. But when you have rehydrated, more water, your systolic might go up and diastolic keep coming down. But as a result, mean arterial blood pressure is more or less maintained on 93, perfection, and within the requirement. And this one part. Second part also, which I would like to bring here, as you grow older, it is the water content which comes down. So as a result, your sugar level, your blood pressure level, volume, cardiac output is tend to go on the higher side because the amount of water is come down. That's the reason why I keep telling again and again, keep yourself really hydrated. You call it water therapy, hydrotherapy, call it anything. But I would not like to talk too much of water at one sitting. I would rather drink water regularly at the rate of at least 4 to 5 liters per day, divided over a period, something which I appreciate. And I give this idea to the movie of Gurudutt, where he talks about it, drinking water at regular interval. I thought, why did he do it? No, I know. It is good for the health. Leave it at that. Now come to glomerular filtration rate is equally important for filtration of this. The amount of blood which is coming and out of what's coming out is 4 stages. First you have filtration, glomerular filtration rate, then you have reabsorption, you have excretion, then you have accretion. But this process also I have explained, and in kidneys we are going to explain it more. In filtration, anything which is in the blood volume is filtered right up to 4 micron size without any problem. And all those things which are vitally required, they are reabsorbed in the first part. But then secretion comes only of those products which cannot be filtered, which are more than 4 micron size, but harmful, are secreted with a passive thing. The first one, glomerular filtration, is passive. Then come to the secretion part, it will be active process. Like sodium, potassium, ATP pump will play an important role to bring those things out which cannot be done otherwise. And that is something which I want people to understand. Once that is understood, you understand the function of the cardiovascular system very clearly. you have passive process from higher concentration to lower concentration where osmosis comes to play. But in second part is ATP, force applied, is against the law from low concentration to the against concentration, and those definitions should also be very clearly defined hereafter. Now the concept of hemostasis. Hemostasis is very important to keep our blood pressure by and large. Now come to the question of autonomic nervous system is there to make sure if blood pressure goes up, it is brought down. When it comes down, it is brought out. This is a picture very clear, we will not talk much about it, but it is mediated through carotid sinuses, aortic sinuses, and of course vagus nerve as well as glossopharyngeal nerve. 9th and 10th play a role in maintaining blood pressure. Then of course the kidneys also play a very important role in decreased blood pressure. Renin is produced by kidneys, then renin, angiotensin, aldosterone combination is brought it together to make sure that you can maintain blood pressure very clearly. Then comes to the question of regulation. Increased salt intake would increase extracellular volume, increase arterial pressure, decrease renin and angiotensin as a result. To cut short salt so that you can maintain blood pressure rate much more clearly, effectively throughout the day. Then increase extracellular. Again, how it can be brought down is very clearly shown here with the autonomic nervous system and endocrine system. That's why they play a role to bring the balance in blood pressure. As I told you, systolic blood pressure 120, diastolic 74, pulse pressure of 46, mean arterial pressure 93, and once these are understood, I think we are very clear with the blood pressure. Now I am going to bring one concept called mitral prolapse because I was diagnosed with that when I was young. But I want to show why murmurs and other things are important, how they can be understood, and why we should try to keep normal things also within that without any problem. 84 I had, and I was taken for radiography and I was given, but I can tell you I have absolutely no problem today. And this I personally feel is because of sympathetic overactivity, which has been my problem from my young days. And that is what is with the Kundalini syndrome. And I call Kundalini syndrome, Ida and Pingala nadis are sympathomimetic. And they tend to do that if you have intelligence. But then, leave it at that. I don't think we can understand so clearly. But then heart sounds are very important areas. These are the different parts which we talk about it. Now let's talk about each individually. Now this particular picture is very important, how heart sounds, ventricles, pressure, other thing can be maintained. In this picture everything is beautifully done. But let me talk of the heart sound. First heart sound is, you can see right at the bottom, is the closure of mitral valve. And 2 is of tricuspid valve. Then in between aortic things as well as aortic refilling is the fourth sound. Let's leave it at that. Now first heart sound, another thing you can see, first heart sound is AV, closure of mitral valve, and then second, third and fourth is a perfectly normal on top. If it is aortic stenosis, you have a picture like this, which is pan-systolic murmur. Then mitral regurgitation is also systolic, whereas aortic regurgitation is diastolic phase. Mitral stenosis is late diastolic, and patent ductus arteriosus is pan-systolic and diastolic full thing. It is only for a given idea, but not going into detail at this juncture. Is leave it to the medical profession. This is just to give an idea how things work. Now come to the blood pressure. This is very important for us to see. As I told about it, systolic, diastolic, but how do you test it is very important. Blood pressure, as I told you, systolic blood pressure is 120, diastolic is 74, pulse pressure is 46, mean arterial pressure is 93. But here I need to bring one correction. Normally medical books say mean arterial blood pressure is diastolic pressure plus 1/3 of pulse pressure is what it is all about. But I would tell you, the real calculation could be, according to Divyank, diastolic blood pressure for 38.1966% of pulse pressure will give the correct value of 93. If you have 93 with this, you'll have a perfectly normal blood pressure. Now that you have understood these are the values, you can go to the next stage. Now, Divyank, as the representation is concerned, you can see at the bottom at aortic level systolic blood pressure, arteries level systolic blood pressure, diastolic. This is 172, this. But when it comes to the capillaries, keeps coming down, ventricles keeps down, veins comes down, vena cava still comes down. That is the graph which I think has to be understood by everybody. But when mean arterial blood pressure is 70 plus 4 plus 19 is 93. Systolic is 120, diastolic is 120. This is all I have graphically presented. And we can do the testing of the blood pressure preferably on left side because it's direct. It can also be done, but I prefer on left side because it gives me better picture than what we do in the right side. Now, as far as examination is concerned, we should do one thing. End-diastolic volume, I have told you before, is 120. Stroke volume is 74. End-diastolic volume 46. Ejection fraction of 74. Cardiac output, I have already explained. This is an important part when it comes to blood pressure. Examination, direct use in animal is different catheter, we do it. But indirect method which is used in human using sphygmomanometer, you have a palpatory method to find out the only systolic blood pressure you can find out, you cannot find diastolic. For diastolic you have to do auscultatory method because that's the only one will do it. Then you have oscillation, you can see it. But there is any unique thing which you can do it, which in case you don't have a stethoscope, but you still want to do it. I can tell you can ask the subject in which is tested, when does the sound he is able to feel and when the sound disappears. The one when it appears is the systolic blood pressure, the one which disappears is the diastolic, and with the oscillation you can make that out. This is another unique aspect which I do talk to my students that it can be done if you don't have a stethoscope and you have only sphygmomanometer. Then basis of cough sound is very important. That's something which I say. When the cuff of the sphygmometer round the arm is inflated above the systolic blood pressure, arterial pulse is fully blocked. Because blood is not flowing into the artery, you cannot see the radial artery at all. You cannot feel it. As the pressure is slowly reduced, arterial blood starts flaring when we reach a systemic blood pressure when it appears. That is first part. This is called turbulence. Is full reach the diastolic phase. This goes on. When we start examining, a clear sound appears and becomes louder for 5 to 10 millimeters every now and then. Second, sound slowly and steadily become murmur for the next 10 to 15 seconds. Next, sound becomes clearer and louder for another fall of 10 to 15 low level. Sound becomes muffler and muffler as we proceed further and further. Finally, the sound disappears, and that is diastolic blood pressure. And this is something which we can easily see and enjoy as a drama of divine nature with the pulse itself, with the pulse pressure turbulences. Now comes the ECG, is a very important part of heart examination. You can see the picture very clearly. And this is a picture which is very clearly shown to everybody. You have a P wave, you have a Q wave, you have R wave, you have S wave, you have T and U. This is a picture which is very, very clearly seen in all the ECGs of a normal person. Let's concentrate only on a normal person. We are not concentrated on this. But what do these actually teach us? Let's go to next one to start. As you can say, SA node, atrial depolarization, atrial systole, ventricle diastole, and first event, a 0.3 second, is what you see in the first three squares as a P wave. That's it. And then AV, that is SA node, and first contraction of atrium part is there. Then R, you have aventricle depolarization, which 0.3 second is the next stage which comes to play an important role, which is connected with ventricular systole. The first one, atrial systole, but ventricular is diastole, and atrial only systole. Then here you have a ventricular systole, 0.3 seconds out of the 0.8 is what you see QRS complex. But after that comes T wave and U wave, which are more into the ventricular diastole and thereafter. I'll not go into this concept, but only thing, as I told you before, in heart rate being 72, this will be the picture. But if the heart rate is more than 100, faster, it is the diastolic phase which is reduced, systolic remains, and left ventricle gets supply during ventricular diastole only, not during systole, because the pressure changes. So bring the heart rate as low as possible. That's the reason when we talk about yoga, we talk about vagoti. That means vagus should be predominant. Take deep breaths. Everything will come down. That's why pranayama plays very important role in maintaining heart health along with lung health and of course the mind rest. That's one. Now comes the cardiac cycle, another thing which we talk about it. Tachycardia, as I told you, increased heart rate. As I told you in 84, I had it because the Kundalini syndrome, I call it. But now I know very well it was because now I know that not to disturb my body, because I got up at night, drank cold water, it was stimulus, and that produced Kundalini coming up to throat level through the systemic so-called sympathetic overactivity, and led to tachycardia, labile hypertension, which came down within half an hour, and I was perfectly fine. But here one thing which I would like to bring it. As the doctor is concerned, he asked me to take tranquilizer for 1 month or 2 months. I said, no, I'm not going to take beyond. And it's been 40 years, I have not touched tranquilizers of any nature whatsoever. I want to have the complaint. I don't want to kill it. I would like to rectify my problem with Ayurveda, with food alone, not with the drugs whatsoever. So I don't take medicines. That's it. Then bradycardia is the lower thing. You can see when block is there, this is the kind of thing which can happen. And you can see the first is a actual pacemakers, and second one, how in bradycardia the rate is low. And those blocks you can easily see here. Autonomic is a conducting system of the heart, normal is 10 centers. Bradycardia is selective thing, can observe the differences, and not all the connections are as perfect as you see in the left, right is missing. So bradycardia below 60 could be a problem, but up to 60, fine. 72 is ideal. Right up to 100 can be okay, but beyond that is very bad. That's something which I've been talking about. Now comes to fetal heart rate is something which I do feel without understanding fetal heart rate, we cannot understand cardiovascular system at all, because very different during birth. And this is also something which helped me to understand I3 Upanishads, Apana Prana easily and connected with umbilical cord as the one which throws it out and also which takes it out. So my knowledge of fetal heart has helped me to decode hidden aspect of one Upanishad called I3 Upanishads, which no one in the world had ever understood. Why Apana Prana is the only one through which the food could be received by the cosmic Purusha. It also shows it's not spontaneous of something. It is a fetus growing in mother's womb, first stage, second stage, third stage, and the supply of nutrition from the mother to the child is through the umbilical cord and also excision with the umbilical cord. I think that was an amazing thing. With fetal heart made me understand this is what it is all about. Now let's understand this. You see the umbilical cord and placenta on one side, umbilical cord bringing it to the heart, and you can see the baby on the other side. Okay, so very clear. There's absolutely no doubt about, and both artery and vein are in the umbilical cord itself. So Apana throw it out is also, receiving is also by the umbilical cord. And that's why the cosmic Purusha of I3 Upanishad is a baby growing in a mother's womb. That ocean of Vaikuntha is amniotic fluid. And it's so beautiful that ancient knew it very well. How did they know it? I can only tell you, they were the great scientists. They were researchers of the highest order. But unfortunately, Veda and Upanishad, particular Veds are called babbling of infancy civilization, is not true. And I have found Divyank only from Veda, Upanishads and scriptures only. So I have been able to understand this, and I found the things were so difficult for a common man. I know even my thing, people find it difficult. When you don't know ABC, how will you know XYZ? And I am not going to bring from XYZ to ABC level because you will get confused again. I would rather elect XYZ at Divyank alone and explain that with the evidence. I am hoping that intelligent people who have the capacity to analyze and find things, perfection, impeccable wisdom, would understand. And then they will enlighten the other people, like the Brahmins of Akhand Bharat did it before. And Brahman of Akhand Bharat will do today also. And I call those people who are intelligent, not by birth. And student researchers should be like Brahmins only, who have a capacity to analyze, to find things, to give the best impeccable wisdom to the world. I call them Brahmin. I do not call Brahmin by birth. I call Brahmin by thoughts, action. Impeccable wisdom is the domain of Brahmin. Let it be very clear. Any coming from any source, from any part of the world, can be a Brahmin, provided you have a thinking capacity, analyzing capacity, and coming to Divyank one by one. And it comes through learning again and then adding value as you go for research. That is important. Now you can see the particular structure in this, how the veins carry blood and go to the heart, and how circulated is given picture. I am not going to detail. Idea was to talk about I3 Upanishad, how it could be umbilical cord with arteries and vein, apana and receive both. That was the main objective. I think I have done that. In this picture you can see how the different structure, there are ductus arterioles, blood vessels on one part, and then inside you have first oxygenated blood is coming, then it's filtered. Since there is no respiration from right side, it's pushed to the left ventricle, and then to aorta by and large, all the circuits which are available to make sure that you do not suffer from cyanosis in a child. It's beautifully designed. I leave it to do. You can read that at leisure when you come through. And these are the structure. I will not go into detail. And this is the structure which also I am not going to go into detail. It's given idea. You can read about it as you go. But now I am going to bring two important factors where ancient wisdom and the modern science is coming very close. There is a process called Bhastrika as a pranayama, and now you have enhanced external counter pulsation too. What they are going to do, increase the pressure in the legs, increase the return pressure to the heart, thereby able to remove all the blocks which are there heart because of diabetes and other things. And this process is fairly useful under observation. I think results have been pretty good. So that way. As this is a table, the patient is lying, pressure is put on the legs, scolds first, then come to the calf muscle and move up. Once this is done systematically, done with it. I am sure same process can be done with Bhastrika alone, where you put the lower abdomen. I would say even take the legs up, contract it, bring it down, and then push it up. You can remove all the blocks, including in the legs, thighs as the upper one. And once that is done, I can tell you, enhanced external counterpulsation, Bhastrika can help you to reach very high level of clarity of blood vessels within the body, one by one. And this is how Bhastrika, you sit in a Vajrasana position. Please get rested for some time. Please test before you go whether you can tolerate it. Please go for long warming exercises. Warm up the physical human body fully. Sit comfortably for a few minutes. Sit in Vajrasana, sitting position as you can see. Let the circulation in the legs fall down. Take in a deep breath and fill the lungs. Exhaust the air from the lungs fully. Please increase the contraction and relaxation of the lower abdomen, and exercise can go up to 200 times. Once that is done, I can tell you are doing Bhastrika very well. You are removing the blocks, including legs, abdomen, heart, and otherwise. I think if that is done, I think we are through to a very healthy life thereafter. Then second thing is Kapalabhati is the cleaning of the nasal as well as head part is concerned. That is also something which helped me to get over. I had a sinus problem all my life. 3 years of post-graduation ENT also did for general surgery PNT, this was, but I could not get. But today I don't have it. But that is learning Akhand Yoga on one side, Ayurveda on the other side, and Kapalabhati by and large helped me to get over the problem very clearly. You can see this picture very clearly. Now, these are the sinuses I have. I told you about 76 to 77 I've done, then 3 years of ENT, but I have no problem at all because I have learned to do this with Kapalabhati itself, remove all that with including Jalneti, etc. Once you understand that 6 treatments of Ayurveda, you can get rid of all the problems one by one. Now I am going to come and talk of the Punarjivan once again because I am very fond that world should know this very well systematically so that we can help person who falls down unconsciously. I want all the general to immediately do something so that they can survive without any interference with that till medical profession comes or expert comes. In the process, as I said, mouth-to-mouth breathing does not work, and why it doesn't work I have already explained, because there is no blood in circulation. Giving oxygen will not help. It has failed, it is going to fail all the time, so let's not waste time on mouth-to-mouth breathing or kiss of life. Lift the legs to the upper portion, increase the venous return to the heart. As I told you, 61 point of the blood is in the venous return. When it comes down, and pulse pressure or venous return pressure as it increases is a good stimulus for SA node. Increase it, let it automatically flow with the gravity to the heart, and good stimulus for SA node. Heart will start automatically, and I have taught this to many of my students and they used it with excellent results. So I would go this for general public, raising of both the legs to that increase the venous return pressure, make as a note revive and be happy with it. The revival is very logical, and I'm sure unless until there is another problem, if it is only a cardiac failure because of something, this will revive. But in case it fails, you can follow it up by pressing on the heart and creating a contraction straight away, and that can be done. Is very good. If medical profession comes, they can put defibrillator stimulus by and large, and I can tell you, you can revive the patient very clearly one by one. That's it. I think we have more or less come to the entire cardiovascular system one by one with the information which in my opinion is fairly inclusive with Divyank at the basic level for everyone to take care of your own cardiac health by and large. Now coming to this picture, as I told you, Ida and Pingala are sympathetic system which are going to give you tachycardia, high blood pressure, demand. So this is where I would like to explain again. The prime function of parasympathetic system is rest, digest and conserve energy for future use. And sympathetic system is to mobilize energy in case of emergency. If you are perfectly healthy, only in case of emergency sympathetic will come to do, or psychological otherwise. But nothing to worry about as long as your blood pressure is not very high. And so are the other factors. But I can tell you from my experience that I have a tendency for sympathy because that is responsible for increasing to the higher levels of consciousness. But then I have also learned how to manage it in my own way, and I think very happy. From that angle, I would say a function of autonomic nervous system on one side, functional endocrine system on one side. Homeostasis is also designed in such a way with the endocrine autonomy nervous system. If blood pressure goes up, it is brought down. When it is down, it is brought up. And the things which are very important in the whole of the hemostatic factor is the amount of blood, water, which is 61 to 8%, sodium, chloride, potassium, electrolytes, hormones, endocrines, all the things finally lead to perfect homeostatic state. And I think already explained, with that body can take care of all things automatically. What happens in reptilian brain, they're designed with that. Right up to brainstem and spinal cord, all the centers within body can take care of our physical health very clearly. And I think that let's leave it at that and say thank you very much. It was lovely talking to you from my experiences rather than just reading from books. And I try to stick to only Divyank so that we have a perfect knowledge without any confusion whatsoever. And this is knowledge which I want every student, because let's not bother about disease models. Let's give a perfect, impeccable wisdom to every child from school, college to the university, because if know the perfection, disease part, let us leave it to the medical profession. They know the job very well. They will do according to the protocol known to them. I have no issues with that, because their allopathy system in emergency plays very important role. Let's use Ayurveda and Yoga to prevent problems by and large. And that is where I come to play a role to make a perfectly healthy, wealthy, wise and happy life. From that angle, I think I am very happy sharing with from my own experiences from childhood till today, how I've handled my cardiovascular system very clearly. In spite of the couple of problems which I went through, but I know I have managed to do beautifully well. And that's it. And with that, come to the end of this particular thing. Thank you very much.